You want to get a handle on healthcare in Thailand, right? Get the key info without drowning in details.
Hmm.
Good, you're in the right spot. Welcome to the deep dive.
Glad to be here.
Today, we're really digging into Thailand's healthcare system. We're focusing on patient safety, hospital quality, and, well, its huge role in medical tourism.
Yeah, and for this, we've pulled together some really interesting sources. We've got academic work on patient safety, articles listing, the top hospitals, medical tourism guides.
And even patient testimonials, firsthand accounts.
Exactly, real experiences.
So our mission today, pull out the most important stuff for you, give you a clear, engaging picture of Thai healthcare. Okay, let's start unpacking. First thing that seems really clear is Thailand's growing focus on patient safety. It's a big deal there now.
Oh, absolutely. It's striking how widely recognized it is. From the Ministry of Public Health right down to local communities, there's this understanding that patient safety is, well, fundamental. It's not just an add-on.
And it feels like a collaborative thing. You mentioned the government, professionals, communities.
Precisely. It's not just top-down. And a key player here is the Healthcare Accreditation Institute public organization, HAI. They actually have the legal mandate for quality improvement and accreditation.
HAI, got it. So they're kind of the driving force behind setting standards.
You could say that, yeah.
Yeah.
They're really pushing the quality and safety agenda forward.
Okay, so the commitment's there. But what about the reality? What's the actual patient safety situation on the ground?
That's the crucial question, isn't it? Historically, getting national stats was tough, limited data. But since about 2006, there's been a real push to build a national data collection system.
Like a central database to track what's happening.
Essentially, yes, to get a better overall view.
Okay.
And this data gathering, it's already shown some things.
Like what? What did they find early on?
Well, a 2006 Ministry of Public Health survey, this covered nearly 400 hospitals, reported over 200,000 adverse events.
Wow, that's a lot.
It is. And the top three culprits were medical error, communication problems, and issues with the care process itself.
Okay, so specific areas needing work.
Right. And interestingly, community hospitals actually reported more adverse events across all these risk areas compared to the bigger provincial or central hospitals.
That's interesting. Maybe resource differences or different patient populations.
Could be a mix of factors, but it highlights where attention might be needed.
So what happens when things do go wrong? Is there a system for patients to raise concerns or get compensated?
Yes. Thailand's had a patient complaint and compensation scheme since 2004. And the data from the National Health Security Office is, well, pretty revealing.
How so?
The amount paid out in relief has gone up dramatically. In 2016, almost 900 patients or families received compensation, averaging about $7,200 per case.
Okay.
But here's the kicker. That's a 40-fold increase in just 10 years.
40 times. That's huge. Does that mean more errors or maybe just better reporting and awareness?
It's likely a combination. Greater awareness, perhaps a clearer process, maybe more willingness to acknowledge issues. Hard to say definitively from just that number, but it's significant.
And which areas of medicine saw the most complaints?
In 2016, the top three were obstetrics and gynecology. That was about 37%. Then surgery at around 15%, and internal medicine close to 11%.
Okay, high-risk, complex areas. Makes sense. But compensation is reactive, right? The real goal is prevention.
Exactly. And that's the direction things are moving. Towards a more proactive, system-based approach. It's about designing safer processes from the start.
So what are some of these proactive initiatives? What's being done to build safety in?
Well, HAI, that accreditation body, is key again. They develop tools, strategies, trying to foster a safety culture.
Tools like what?
One example is the community practice started in 2012. It focused on 4 high-risk zones: ER, labor room, operating room, ICU.
So getting people in those critical areas, talking, sharing what works, what doesn't.
Exactly. Knowledge sharing, learning from experience. Then, in 2013, they set up the Thailand Hospital Indicators Project.
For benchmarking, letting hospitals compare their performance.
Precisely. See where they stand, where they need to improve. But, progress isn't always instant. Despite these efforts, improvements in reducing adverse events, especially medication errors, have been, well, gradual.
It takes time to change culture in complex systems, I suppose.
It really does. Which led to the Engagement for Patient Safety program in 2014. The idea was getting everyone involved, patients, staff, admin. This then fed into a specific patient and personnel safety policy from the ministry.
So really trying to embed safety at every level. Let's zoom in on the hospitals themselves. What tools are they using day to day?
Again, HAI's accreditation is central. Hospital accreditation, or HA. It's a three-step process.
3 steps. Can you break those down?
Sure. Step 1 is about the hospital understanding its own risks, where are things most likely to go wrong,
Yeah.
and planning how to manage them, sort of integrating quality checks into daily work.
Okay, self-assessment and planning.
Step 2 is putting systems in place to meet specific HA standards. Think risk management protocols, infection control, medication safety, safe environment, care processes, making tangible improvements.
Right, building the infrastructure for safety.
And step 3 is when they can actually show they've achieved better quality and safer outcomes. That's when they get full recognition.
How widespread is this accreditation? Do most hospitals participate?
As of late 2017, the figures were quite impressive. 55% of hospitals were fully accredited,
Over half.
and nearly another 10% were at step 2. So roughly 65% had at least some formal risk management system in place. That's substantial progress.
And patient safety is a core part of this accreditation review.
Absolute fundamental. Surveyors discuss adverse event data, help staff refine incident reporting. It's very hands-on.
Okay, that makes sense. Now, you mentioned something called SIMPLE earlier. What's that about?
Ah, yes. Simple. It was a guidebook, basically, developed by HAI back in 2008 with lots of input from different groups. It's an acronym.
Let me guess. S is for?
Safe surgery. Then I is infection control. M is medication and blood safety. P is patient care process.
Okay.
L is for line, tubing, catheter, and lab safety. And E is emergency response.
Simple. Got it. So, a set of key focus areas.
Exactly. Shared priorities.
Yeah.
Practical guidelines for the big risks, aligned with international standards, like from the WHO. It gives hospitals a framework to set their own specific goals within those areas.
And they use tools alongside this, like root cause analysis.
Yes, things like root cause analysis to understand why incidents happen, and also something called trigger tools.
Trigger tools sounds intriguing. What do they do?
Well, you know how sometimes incidents don't get reported? Underreporting is a common challenge.
Sure, people might not realize or they might worry.
Exactly. So Trigger
Yeah.
Tools HAI adapted these from the Institute for Healthcare Improvement in the U.S. are a way to proactively look for unreported events by systematically reviewing patient medical records, looking for specific triggers like certain lab results, medications ordered, or sudden transfers that might hint an adverse event occurred, even if no one filed a report.
So it's like actively searching for clues instead of just waiting for reports to come in.
Precisely. It gives a more complete picture. HAI started introducing this to hospitals, doing quality improvement work back in 2007.
Okay, so lots happening within hospitals. What about the bigger picture, the whole healthcare system?
Yeah, the effort definitely expanded beyond just hospitals. The Ministry of Public Health launched that big 10-year plan for patient safety, running 2015 to 2024.
The one with different phases?
That's the one. It supports things like the Indicator Project and the Communities of Practice we mentioned, and that Engagement for Patient Safety project really underscored the need for all stakeholders to be involved.
Can you remind us briefly about those phases? What were the goals?
Sure. Phase 1, 15 to 17, was about awareness, building tools, creating networks, getting the foundations right. Phase 2, 18 to 21, focused on setting national goals, getting safety into education curriculums, scaling up model hospitals for patient safety, improving reporting, developing outcome measures, more concrete actions.
Right, embedding it deeper.
And phase 3, 22 to 24, is about sustainability. Building lasting structures, fostering innovation, public engagement, transparency about hospital outcomes, legal protections for data, linking globally, research. Really aiming for a pervasive safety culture.
That is incredibly comprehensive, a long-term vision. Okay, let's shift gears slightly. Bangkok comes up a lot as a center of excellence. What makes it stand out?
Bangkok, especially its private hospitals, has really positioned itself as offering top-tier care, often on par with Western standards.
We're talking cutting-edge tech, internationally trained doctors.
Absolutely. State-of-the-art facilities, doctors trained overseas, multilingual staff. They're really geared towards international patients.
This is very much designed for medical tourism.
Very much so. Some offer packages, almost like travel deals. And the environment. Some feel more like luxury hotels than hospitals. Patient comfort is a huge focus.
The sources list quite a few top hospitals there. Can you name a few key ones?
Sure. There's B&H Hospital, known for its history and international standards. Bumrungrad International is probably the most famous, a real leader in medical tourism, JCI accredited, huge capacity, dedicated international center.
Okay, Bumrungrad is a big name.
Then you have Semitivay Sukhumvit, another major player, Bangkok International Hospital, known for tech and specialized centers. Viet Thai hospitals have a strong international focus too. St. Louis, even though nonprofit, is noted for diagnostics. Ron Kumheng focuses on medical tourism with competitive pricing. Samavid Srinacharan, Vipavati. There are several really strong
So a
contenders.
lot of choice at the high end. And it's not just general medicine, right? Dental seems big too.
Definitely. BIDH Dental Hospital gets a specific mention. Specialized, international standards, digital dentistry, big focus on safety. They see a lot of international patients, even have their own labs for faster turnarounds.
It sounds like even expats living there often choose these private options.
That's often the case, yes. Better service, shorter waits compared to public hospitals where, customer service might not be the top priority.
Public is cheaper, though.
Generally, yes. But private hospitals often attract experienced specialists, maybe offer more face time with the doctor. And for working expats, Social Security covers basic care at assigned public hospitals. But many opt for private insurance to get access to these private facilities.
Right. Now, the big draw for many is cost. How significant are the savings compared to, say, the U.S. or Europe?
They can be really substantial. With costs rising in the West, Thailand offers treatments that can be, according to some sources, up to 70% cheaper.
70%. That's incredible. For what kinds of procedures are the savings most noticeable?
Things like hip and knee replacements are often mentioned. Cosmetic surgery, nose jobs, breast lifts, that kind of thing. Dental work, especially implants, veneers, whitening, and also IVF treatments.
Of course, medical tourism isn't without potential risks or hidden costs. What should people be mindful of?
That's crucial, yes. You need to factor in travel, accommodation. What if there are complications needing longer stays or follow-up? Language barriers can still exist, although less so in the top international hospitals. And healthcare laws and regulations differ.
So it requires careful planning.
Absolutely. Using reputable facilitators can help manage these risks, guide you to accredited hospitals, sort out logistics. But potential patients need to do their homework.
Looking ahead, Thailand seems set to remain a major player, maybe even grow its medical tourism sector.
The outlook is strong. Projections suggest maybe over 3.5 million international patients by 2025. It's consistently in the top 5 destinations globally.
Why the continued success?
It's that combination. The cost savings, the high-quality infrastructure and skilled doctors, and providing care that's culturally sensitive. People come for everything from elective procedures to complex surgeries to wellness retreats.
To make this more concrete, let's talk patient experiences. The sources mentioned testimonials from Yanhee Hospital. What do they typically say?
Yeah, those testimonials paint a very positive picture. Recurring themes are, amazing staff, helpful, English-speaking coordinators feeling supported and reassured.
So the human element really shines through.
It seems so. Communication is frequently praised. Cleanliness, comfort, even the food gets good mentions sometimes. People talk about thorough care, safety checks being evident.
And positive outcomes, presumably.
Yes, positive surgical results are a common theme, leading to high recommendations. And the range of procedures is wide mastectomies, lifts, tucks, implants, facelifts, lipo, rhino, gender-affirming surgeries, hysterectomies.
A real spectrum.
And you see people saying they'd come back for more work or comparing it to a 5-star hotel experience. The value for money aspect often comes up too.
Those personal stories really add another dimension, don't they? Beyond the stats and accreditations.
They really do. It brings the quality of care and the patient focus to life.
Okay, so wrapping up this deep dive, what are the main takeaways for our listeners about healthcare in Thailand?
Well, I think first is the clear, structured commitment to improving patient safety, driven by national plans and accreditation. Second, Bangkok's private hospitals offer genuinely high-quality care, attracting a lot of medical tourists with their tech skills and service.
And the cost savings are real for a wide range of treatment.
Definitely. And finally, patient experiences, based on testimonials at least, seem very positive, highlighting attentive, caring staff.
So for you listening, hopefully this gives you a much better, more nuanced understanding of Thai healthcare. It's clearly a significant and sophisticated system.
And it does make you think, doesn't it? Thailand's progress in safety and its success in medical tourism. What does that signal for global healthcare access and affordability more broadly?
That's a great question.
Or, if you're personally considering medical travel, perhaps this discussion highlights areas where you might want to do some more specific research for your own situation.
Yeah.
Lots to ponder.